Hello everyone, welcome to my channel. Today I'm going to talk about diabetes. I'm going to give some introduction, then talk about types of diabetes, and I'm also going to talk about what happens in each, what are the symptoms, and about the medications and oral manifestations. So let's begin. So before I move into the next slide, I wanted to explain what happens in diabetes. Actually, in diabetes patients, what happens is the glucose is not utilized by each and every cell in the body. Like, for example, you are having a glass of juice. When you drink that, that needs to be broken down by into simpler substances and used by the body. If that sugar just keeps building up in the body, that will lead to diabetes. Now, that can happen because it has something to do with insulin. Now, what happens with insulin is important because it will allow glucose to be absorbed into the cells of muscles and other tissue. Now, the main important thing is glucose needs to be absorbed, and that happens mainly because of insulin. Now, if there is an insulin deficiency, then the glucose will be more and more present without being broken down in the blood. Or there might be insulin, but there might be resistance. Now, what happens with that is there is a lot of insulin in the body, but it doesn't bind to the receptors and they become resistant, like our body doesn't use insulin. Then in both the cases where there is insulin deficiency or insulin resistance, there is a lot of glucose that is going to be, accumulating in the blood that will lead to buildup in the sugar. All right. In that case, when the body cannot absorb the glucose, what happens is it starts breaking down fat for energy. And there will be lot of acids in the bloodstream in the form of ketones. So you can see ketoacidosis in the patients and a fruity smell can be observed. Now, like I told you, high glucose in the blood can be seen in diabetes, and actually it can harm kidneys, it can harm nerves, it can harm your eyes also. So there might be retinopathy, neuropathy, and nephropathy in case of uncontrolled diabetes. So diabetes is of two types: diabetes mellitus and diabetes insipidus, which I'll be talking about. Diabetes type 1 is diabetes insipidus, and diabetes mellitus is most common, and that is type 2 diabetes. In diabetes patients, you can see there is polydipsia, polyphagia, polyuria. Means the patient might feel thirsty, might feel like eating a lot of food and urinate a lot. All right. In diabetes type 1, what can be seen is like it's mainly because of pituitary gland deficiency and ADH insensitivity will lead to production of excessive amount of water, and the patient will urinate a lot. In these patients, who are about like 5 to 10% of all the diabetic cases, it is usually seen in younger individuals. And the treatment is usually insulin is injected subcutaneously, and self-monitoring of blood glucose is important. Okay, and all the patients are insulin dependent. Now, what happens is autoimmune reactions kill beta cells in. So let me just draw. So this is pancreas, and then there are beta cells. Beta cells mainly give insulin. And what does the insulin do? It will make sure that glucose is broken down and it is used in the form of energy. Now, there is an autoimmune reaction that happens in the body which kills the beta cells. Now, if there is no beta cells, then there is insulin deficiency, because without beta cells, there is no insulin production. That is the reason why the patients have to depend on synthetic insulin. Okay, and these patients have a fruity smell, also called as ketone breath. Now, type 2 can happen because of obesity, poor diet, or it can be genetic also. Now, here what happens is, even though insulin is floating in the blood, the target cells in the blood, like you see, this is in the blood, the target cells in the blood are no longer sensitive to insulin. So they won't bind with the insulin. So there is insulin resistance that can be seen. All right. So it can be managed with the help of medication, proper diet, and by avoiding sugar. But in late stages, the patient might require insulin injection. Okay, and let me tell you something important. Even in polycystic ovarian syndrome and polycystic ovarian disease, there might be insulin resistance sometimes. And you might be wondering, is there a chance that these patients might develop type 2 diabetes? Yes, there is an absolute chance that, PCOD patients can develop type 2 diabetes. So just keep that in mind. And during pregnancy, gestational diabetes can be seen. What happens is mainly there is it occurs only during pregnancy, and after the birth the patient becomes normal. It can be seen in the form of type 1 with insulin deficiency or type 2 with insulin resistance. Now, what are the two methods to measure diabetes? One is with the help of glucometer, or another one is with the help of HbA1c. Now, what is this glucometer? It's a machine where you have some strips, and you have to make sure that your hands are clean. Wash your hands with the soap, and then use a swab, use a nice clean cloth, clean your hands properly, and take the sample, and then you'll notice what is your blood glucose level. And HbA1c is a more reliable test. Now, what does this test do is, this is a red blood cell. Now, it will show hemoglobin protein in the blood sample that is coated with sugar. Now, the lifespan of the red blood cell is 120 days. So it will tell you how much sugar is being bound to these cells in the blood from past 3 months. So why do I say that this is more reliable and glucometer is not? Because suppose think I have, I slept well, and then I woke up in the morning, I'm doing my blood test with the help of glucometer. And then maybe last night I ate a lot of candy, lot of sweet things. Of course, my blood sugar will be high, and it will change depending on what you have consumed. Okay, so that's why I'm saying that HbA1c is more reliable method, but it's always good to have glucometer if you're suffering with diabetes, so that you know immediately when you're feeling dizzy, or like just for regular monitoring of yourself, glucometer is really important. And diabetes and blood pressure are said to be related. So many patients suffering with diabetes can also suffer with hypertension. So always have frequent BP checks and foot checks. Okay, because foot checks mainly for diabetic neuropathy. There might be nerve pain that diabetic patients might experience. Always go for annual eye exams, and also microalbumin urea screening is important, so as to know, how are your kidneys doing. All right, and lipid profile every 2 to 5 years is recommended. Now, how do you know if a person is pre-diabetic, diabetic, or normal? So let me just draw the. So we know that HbA1c test can be done. Fasting blood sugar is when you take your blood sugar sample first thing in the morning after a fast. And glucose tolerance test is actually when you fast the previous night, and then in the morning you're given like some glucose, and after 2 hours they take the blood from your hand and then check for how much is the sugar level. So if a person is suffering with diabetes, or if it is a pre-diabetic condition, or a person is normal. So HbA1c will show that it is 65.5% or more comes under diabetes category, 5.7 to 6.4 comes under pre-diabetic category, and less than 5.7 comes under the normal category. Now coming to fasting blood sugar test, it is 120 mg by deciliter, and pre-diabetic is 100 to 125, and normal is 99 mg by deciliter. Glucose tolerance test is 200 mg by deciliter, because you just had a lot of glucose, so it's of course going to increase your blood sugar, or 140 to 199 or 139. These are the normal levels. Now, how do you manage type 1 diabetes. So as discussed in the previous slides, we learned that beta cells are the ones responsible for producing insulin, and they help breakdown of glucose into energy, and it is absorbed in each and every cell. Now, if that beta cells are not producing insulin because they are being attacked as a part of autoimmune reaction, then there is no insulin production. So in type 1, we completely depend on synthetic insulin, all right, which is taken subcutaneously. Now there is rapid acting, short acting, intermediate acting, long acting. Usually before food, one rapid acting insulin injection is given, and after food also it's taken. All right, so these are the different types. Now coming to the tablets: sulfonylurea, biguanides, and dipeptidyl peptidase 4 inhibitors, DP4I, and thiazolidinedione or alpha glucosidase inhibitor, and SGLT2 inhibitors are the medications. Sulfonylurea and biguanides are the ones that are most commonly given. Now, what does the sulfonylurea do? It's an insulin secretagogue. Now, what does that mean is, what does it do is, we know that beta cells give insulin, right? So it enhances insulin secretion by beta cell. Now it is acting on the beta cell. Sulfonylurea always acts on the beta cell, all right, and it is given 30 minutes before the meal. And biguanides, so this is before meal. Biguanides is given with the meals. Okay, so what does it do is, it mainly helps in reducing glucose production. Now, so it will make sure that glucose production is less. It will decrease, it helps in like decrease in the glucose formation. So what will it do is, it will decrease glucose uptake from the intestine and increase glucagon production. So sulfonylurea makes sure that there is insulin secretion by beta cells, and it is given before meals, and biguanides is given with the meals. Okay, and dipeptidyl peptidase 4 inhibitor, it is taken regardless of the meals, and what it does is, it blocks the action of DPP4, an enzyme which destroys the hormone incretin. Now, what does this incretin do? So there is an enzyme that is actually blocking this incretin. So if we block that, then there is hormone incretin present, and this hormone will help in production of more and more amount of insulin. Now coming to thiazolidinedione, it is given along with meals, and what it does is, it improves insulin sensitivity for muscle and fat cells. They increase glucose transporters so that blood glucose is less. Now, alpha glucosidase inhibitors work by competitive and reversible inhibition of intestinal enzymes. Now, what happens over here is, they delay the digestion of carbohydrate. So, what do is, glucose is excreted in this case. In case of alpha glucosidase inhibitors, glucose is excreted. Okay, instead of getting absorbed and used. So what happens? Beta cells give insulin, and insulin will act on glucose, and what will happen? It will be absorbed by each and every cell in the body. Now, instead of being absorbed by each and every cell in the body, then what will happen is, it is digestion in the gut of carbohydrates is delayed, and the glucose is excreted. Okay. Now coming to SGL2 inhibitor, what happens over here is, selective inhibitor co-transporter system in proximal convoluted tubule in the kidney is seen. Here, glucose is urinated. Now, if there is a lot of sugar in your urine, then there is a chance for bacteria to act, and there is more and more chances of urinary tract infection. So the last two ones which I have discussed are not used much, because they have really bad side effects. Now, sulfonylureas, what do they do? They are given before meals, and what do? They make sure that insulin secretion is enhanced by beta cells. Biguanides is given along with the meals, and main primary mechanism is to make sure to reduce glucose production, and there is new glucose formation is reduced. That is called gluconeogenesis. Neo means new, genesis means formation. So new formation of glucose is reduced. And in dipeptidyl peptidase 4 inhibitor, there is an enzyme which is blocking the formation of incretin that helps in production of more and more insulin. So that hormone which is blocking the incretin is blocked. So therefore, insulin is more. Now coming to thiazolidinedione, here what happens is it improves insulin sensitivity for fat and muscle cells. Now coming to alpha glucosidase inhibitors, what they do is they make sure that instead of glucose being absorbed by each and every cell in the body, it will make sure that there is delay carbohydrate absorption in the gut, and it will make sure glucose is excreted. And SGLT2 inhibitors, they make sure that glucose is urinated. So when in the urine the sugar is present, there will be a lot of bacterial infections and they are more prone to UTI. Now, there are two medical emergencies which you need to keep in your mind, either in practice or just, if you have any of your close ones suffering with diabetes, make sure that you know something about hypoglycemia and hyperglycemia, not in just a dental aspect or as a medical student, but also as a family member to a person who might be suffering, or you might know a person who might be suffering with these conditions. Now, a diabetes person might go into hypoglycemic condition or hyperglycemic condition. Now, if there is less blood glucose, then it can lead to hypoglycemia. And if there is more blood glucose in the body, then it can cause the person to be in hyperglycemic state. Now, in hypoglycemia, what happens is blood sugar is less than 70 mg by dl, and there might be two things. One is patient is conscious. So if you know any diabetes person, make sure that the person carries some candy or a chocolate, so that if the person is about to feel dizzy, it's better that he takes the chocolate and he will be fine. Okay, if he's conscious, always while you're doing a dental treatment, if the patient is conscious, give an orange juice or a glucose tablet. If it's unconscious, there's nothing you can do right away. So call emergency services and give IV dextrose or IM glucagon. Now, how do you remember the symptoms? Is by the acronym TIRED. The patient will have high heart rate, tachycardia, irritability, restlessness, excessive hunger, and there will be sweating that you can see. Now, in hyperglycemia, the blood sugar is more, and it can lead to life-threatening complications like diabetic ketoacidosis, where a person can go into diabetic coma. So how do I remember the symptoms for this? Is by the acronym SINFUL. Sweet breath, that is, we know that it's called ketone breath, increased thirst, nausea, vomiting, frequent urination, and loss of vision. Now, what are the drugs to avoid? Is glucocorticoids can increase blood glucose level. So always make sure that you avoid these drugs when you're treating a patient. So always take a detailed history. So you have to know if the person has a history of diabetes, hypertension, and everything. And always have a glucometer in your practice, so that, if you're doubtful, please check the patient's blood sugar before doing any procedure. Levofloxacin can be used to treat oral infections, and always make sure the patient has normal meals and normal insulin levels. Always keep glucose sources available, so that if the patient is dizzy, you can give them orange juice or glucose. Now, if it's poorly controlled, it's better that you only do emergency treatments, not like elective treatments. So if the diabetes is uncontrolled, you might want to consider giving antibiotics before the treatment. And there's always correlation between hypertension and diabetes. So always check on the person's blood sugar as well as his blood pressure. Coming to oral manifestations, so the person might have fruity smell, and there might be a lot of plaque buildup, halitosis might be there, and infections might be there, dry mouth or xerostomia can be seen. Wound healing is very much delayed. So, you cannot do laser treatments on an uncontrolled diabetic patients, because the wound healing in laser treatments is by secondary intention, and it is not advisable to be done in a diabetic patient, because Even small injuries, diabetic patient takes long, like a lot of time to heal. So that is the thing you should keep in your mind, and there is more chances of infection. So always the diabetic patient needs to make sure that he protects his foot, or else it can lead to several infections. Oral candidiasis also can be seen, parotid gland enlargement can be seen, and diabetes patients are more prone to periodontal diseases. Now, if a person is going for any treatment, usually GA is not a general anesthesia is not a good option for a diabetic patient. But if the patient is going for sedation, then half the insulin dose and along with supplementing with intermittent glucose whenever needed is mandatory. Now you can see like these patients also suffer with memory loss or amnesia. So in case you have understood about today's topic, please do like, share,